All right, as we continue along, this next segment is a community affairs program tonight with guest Rachelle Riddle, and I thought you was going to have a guest with you, but I put a little line there.
She wasn't available tonight.
Okay, all right, and this program does not necessarily reflect the views of WRVK and the staff and management of this program. Alrighty, with that, Rachelle Riddle, I watched you grow up.
Yes, you did. You were my 6th grade math teacher.
Yeah, that's crazy.
Yeah, he used to let us put Jonathan Taylor Thomas pictures on the wall. Yeah.
How old am I? I'm sitting here thinking, I had this kid in school, and I'm going like, good gracious, you know.
Well, I'm 40 now.
Oh.
So my son tells me I'm old, so I'm not one of the young people anymore.
And work with your dad and mom.
Yes.
Connie.
Yeah, they were teachers. Yeah. And, you know, a lot of my perspective on the topic I'm going to cover tonight, the medical cannabis, it comes from, you know, the influence of my dad being a science teacher. And, you know, I try to look at things through an unbiased perspective and do, you know, scientific research to, you know, I form my hypothesis, of course, but, you know, like I know my hypothesis isn't always proven by my conclusion and my results. So, you know, I've looked up a lot of information about this, and when I heard that this was going to be a topic at our fiscal court meeting, I was contacted by some concerned, you know, community members that wanted, you know, an opinion spoken about that they weren't sure was going to be shared in that meeting. So they asked me to go speak, and I attended, and I had 30 minutes. I had no time to prepare, but like I said, I've done a lot of research on this.
So you spoke for 30 minutes, and tonight you've got...
No, I had 30 minutes to prepare to speak.
Oh, you had 30 to prepare.
Yeah, I only spoke for 10 minutes. I don't like to speak. I don't like to... if I'm there, it's because somebody's asked me to be there, and I feel like I need to speak up for people. So, I was a little bit about my background. I was a pharmacy tech for 6 years, and I worked at Broadhead Pharmacy under Howard Saylor, and that was in my 20s. And I grew up in a generation that was greatly affected by the opioid epidemic. You know, we've lost a lot of friends and family members. My own family, my son's father's affected by this. So this is something that's very important to me. And I think that we all share a common goal when it comes to medication, that we want safe alternatives. You know, not every medicine works for every person. You know, we're all made of a different chemical combination. We can have different deficiencies and imbalances. And, you know, especially as you get older, a lot of things go out of balance. And, you know, you have to take things you didn't used to have to take. And, you know, I'm 40 now, and I have to take medicine, and I didn't have to do that before. And with all medicine comes side effects, you know. And most of these medicines we're taking, they're not created to cure something. They're simply treating the symptoms, you know. You don't take Tylenol to cure a headache. It just lessens the symptoms, you know. Medical cannabis can be used in the same way. And it's used for a lot of different things. I know before I was on, you had, you were speaking about cancer and the Relay for Life, you know. And this is something that can be beneficial to those patients. You know, I listened, and she talked about education and being better informed, and like raising awareness and advocacy for research and science and early detection and screening and access and patient support services. And, you know, as an advocate for patients and for people, you know, I want them to be able to access medicine that their doctors think can help them and provide less side effects than medicines that they've been taking. And like I said, I think we all have a common goal when it comes to less dangerous medical alternatives. Like, you know, aspirin's perfectly legal. Comedian said you take 6 of those, it'll be your last headache, you know. Like, there are far more dangerous drugs that are already on the market, and living through the opioid
Do you look
process.
at the synthetic TCH?
It's more dangerous, actually, than the natural substance. And I actually looked up, you know, the scientific research on this stuff. And, you know, when I look up stuff, I also use Google Scholar. A lot of people don't, a lot of people, I've got graphs. I know you love math and math, or charts and graphs, and I love that stuff too. I'm also an artist, so I like visuals, and I know that helps people. But, you know, the conclusions of this study and it was Can Cannabis Kill? Characteristics of Death Following Cannabis Use. And this was conducted in England. It's the most recent study I could find between 98 and 2020, and that's a good chunk, you know.
Mm-hmm.
A lot of the research that I've been seeing in this debate is outdated, you know. So I graduated in 2023 in December. So a lot of this research I've recently done, my final policy paper was a presentation on this issue.
Mm-hmm.
So I do know a lot about this. I'm not by any stretch of the imagination trying to say that I'm an expert, but I do know how to do the research, you know. And the conclusions of this was the risk to death to cannabis toxicity is negligible. So, however, cannabis can prove fatal in circumstances with risk of traumatic physical injury or in individuals with cardiac pathophysiologies. These indirect harms need careful consideration and further study to better elucidate the role cannabis plays in drug-related mortality. So the relevance of cannabinoid quantifications is determining cause of death, and it's very limited. You know, a lot of big words, but those big words are just saying that this drug is not as dangerous as we thought it was. New research needs to take place. So in order for us to be able to have the research and the resources that we need to further understand this possible medication, it has to be declassified, because right now it's scheduled as having no medical use whatsoever. Mm-hmm. But, you know, the science community and the medical community has agreed for years that that is incorrect. Mm-hmm. So recently we're looking at the federal level from the scheduling being moved from 1 to 3, which says that it does have medicinal use and that its likeliness to be, you know, addictive is lower. So it's classified with heroin, and, like, you know, heroin's a terrible thing, you know. Like, I know lots of people have died from heroin. I don't know anyone who has died from cannabis, you know, and I've lost a lot of friends throughout this process of learning, you know, and they told us that Oxycontin was non-addictive and safe, you know, and they handed it out like candy, and they were wrong, you know. Exactly. So we have to be able to look back and understand when we were wrong. We have to be able to correct ourselves and to do better, and I think that it is crucial that patients have access to this medication. I think that a lot of the synthetic made medications have a lot of side effects that a natural drug does not. And whenever you get into that, you get into more medications for those side effects, because, again, you're treating symptoms, right? You're not curing illnesses. So then you end up with an endless list of medications. We called them books when I worked at the pharmacy. We'd have to fill books, you know, and a lot of those medications those people were taking were just for side effects. And then they have side effects, and then they interact with the other drugs chemically, and they cause different effects. So a lot of times when cannabis is found in the system of someone who is deceased, it's not alone, you know, like it
stays in the system for
because we have an endocannabinoid system. We weren't taught that, you know. Our body produces natural levels of THC. So our body doesn't try to flush it out like these synthetic substances that we put in. It actually maintains that. And here's the kicker. We have all those chemicals in our body. If the chemical we're deficient in is THC, we can't get that without medical cannabis. You can have it synthetically made. There's a drug called Marinol, you know, but it's not the same. And those drugs are more dangerous because it is a synthetic drug, you know. Same with our food, you know. I think that we're learning and finding out a lot of our medical problems are due to what we put into our body. We're not growing our food anymore. We're eating food-like substances with chemicals and additives and antibiotics, and those things are causing health problems. So the more natural the state of what we put into our body, the better off we are. And I highly respect and dearly love the people on the opposite side of this debate, you know. I saw my high school principal, well, not just high school, he was my elementary, middle school, high school principal, you know, gave me a big hug, and we had conversations after the vote, you know. Same with his wife. She was my gifted education teacher my entire life. They taught me how to do the things that I do today, you know, and it's not easy to disagree with people like that. You know, my own family.
Well, I think
you know,
as long as we're agreeing to disagree.
oh, and be respectful.
And you know, that's one of my philosophies, is to agree to disagree.
Absolutely.
And on either side, I mean, we are all really, when it comes down to it, there's one thing that we are concerned about: our children.
Absolutely.
And what cannabis does to their mind.
Can I address something about a child? So I wanted Glenda Jo to come with me tonight, but she couldn't because she had her kids. So last night she was in attendance at the fiscal court meeting, and she spoke on behalf of her daughter Aaliyah. And I'd spoken the first time at the fiscal court about, you know, there's specific strains that have been created for seizures in children, because these drugs that we give people for seizures, they have horrible side effects. They're also not effective. So there's a strain called Charlotte's Web that was created, you know, genetically engineered for this little girl. Mm-hmm. And her seizures went from 100 a day to like 2 or 3 a week. You know, her quality of life improved. You know, so Aaliyah is Glenda Jo's daughter, and what she said, I'll just read her words. My daughter's 12 years old and suffers from epilepsy. She was diagnosed when she was 18 months old. We've been dealing with this diagnosis for 11 years. She's been taking Keppra, which has increased over the years. As of now, she's on 4,000 milligrams a day. So far, Keppra is the only medicine she can take for the different seizures she has. 4,000 milligrams of Keppra is a high dose to help control seizures. Are her seizures under control? No. We've had multiple EEGs, MRIs, ER visits, and trips we make to Cincinnati Children's Hospital. The side effects of Keppra are horrible. Nothing a 12-year-old child should ever have to go through. Aaliyah's had anxiety, depression, mood and behavior changes, not being able to sleep at night. All of these stem from epilepsy. And the medication that she's taking. Would I try medical cannabis for her condition to get results without these horrible side effects? Absolutely. If you were in my shoes for the last 11 years, you've tried anything to help her. Her death rate is 1 in 500. Let that sink in. It's hard as a parent to even speak about it. I hope your decision is looked at from both sides. Could this possibly help Aaliyah? We don't know if we haven't tried. Mm-hmm. There's so many Aaliyahs and Charlottes. And it's not just epilepsy. You know, I watched my friend's mother die of cancer. And the only thing that provided her relief was medical cannabis. And she could not go to her doctor and get that prescription, you know. And I see this in a lot of people. You know, I see the good. I see the good side.
Is there going to be distribution sites or something?
Well, it's dispensaries, but see, all of this stuff can change once the classification changes, because once it's considered to have medicinal use, it can be moved into the pharmacy. You know, and depending on the classification and where exactly it lands, you know, drugs are all kinds of things. It's chemicals. Caffeine is a drug. Mm-hmm. You know, like tobacco's a drug. Alcohol's a drug. You know, a lot of these things have been illegal in the past. Things change. You know, but that's the important part. Is when we get the new information, we have to be able to shift in that direction and change our minds and provide for these people, because I see myself as an advocate. Mm-hmm. And, you know, I was asked, why are you so passionate about this? And I'm passionate about it because I see people hurting. And I see a better way. And what we have clearly isn't working. You know, I also had a 17-year-old girl who, you know, she wanted to speak, but she wasn't available. A lot of times when these opportunities come up, these people are working, they're in school, they're on vacation, you know. She said, up until May of this year, I was a student at Rockcastle County High School. I personally do not use marijuana. However, I can speak for what I've seen. I can assure you that marijuana is in our community and available to any of the youth. In every classroom, there is at least one user at the high school. While you cannot overdose on marijuana, illegally made and distributed marijuana can potentially contain fentanyl and other things. I'm sure that you know several pens that have been confiscated that have tested positive for fentanyl. Several students have been affected by fentanyl and marijuana themselves, and so have their family members. By allowing commercialized medical marijuana to come into our community, we're essentially eliminating the need for drug dealers, as they cannot make a profit off minors alone. Not only will this limit access for minors, but it will also provide safer use. And this is a 17-year-old.
Have you done studies of Colorado, for example?
Oh, absolutely. And what you see is your numbers. It's the same. Well, it's the same kind of argument they had against alcohol. Mm-hmm. You know, if you increase access, then use increases, but it's not. What actually happens is whenever you prohibit something in a space, people just go out of that space to get it, and they're driving back with it, which adds another element of danger to the equation, because you don't want people driving intoxicated. And that's on, you know, hydrocodone, Xanax, any kind of medication comes with a label. You know, so you want to limit that. You don't want these patients to have to drive out of town to get their medicine to take it, and then have to drive back home intoxicated because they're in pain and they need their medication. You want access in your own community, and you want to provide a stable, controlled product. You don't want people to go to a drug dealer. It's like during Prohibition, they had bathtub gin. Nobody makes gin in their bathtubs anymore. You know, like, it killed people. It's not clean. You know, once you have access to a clean product, you switch over to a clean product where you have labels. You know, you could find a strain of cannabis that serves your medical needs, and then you can grow your own medicine.
Do you think there's a correlation of the cannabis, and I know, and looking at Colorado, they are sort of backing up now, you know. With
Well, they were the first to go.
They were.
You never want to be the first,
Yeah.
but you don't want to be last
But
either.
do you think there's a correlation in crime, though? I see, we're talking
All
about...
the research studies say no.
We're talking about medical. How many, in our population, how many people medically have you researched to use it? And then how many people abuse it? You know, and
Well, it's the same studies. It's not any different than any other drug. There are people that get hydrocodone and they abuse it. There's people that get
But
oxycodone.
I'm talking specifically about this particular one.
That's one of the problems with our studies, because you can't get federal funds to do these studies, to do these medical studies in these universities, because it's classified as having no medicinal use. So these research studies are having to be funded by special groups, which also you don't want in your medical research. You don't want, you know, you don't want any bias. You want people that are looking for the right answers. So a lot of the information and the questions that we have, we can't answer those, but there are things that we very well know, and we know it's not as dangerous as many legal drugs right now. And I think that's the ultimate factor in this, is a safer alternative. I would love to see people that, you know, one of our magistrates last night spoke about his wife at the end stages of her life. I would love for her to have been able to try a different medication, you know, instead of having to suffer and be out of her head. And if it was possible, why not? You know, I also had a friend, my best friend. She's always been my best friend. She called me right before I came here, Tyva Robinson. She was in a car accident when we were little girls.
Actually, she's in our family.
I love Tyva.
Yeah.
Tyva scared me to death. Okay? So, and it's not, past couple days have been rough. You know, she has seizures. She had traumatic brain injury. She has cluster migraines. The only thing that her doctors think that can help her, that she has not tried in her 40 years of life, is medical cannabis. And Tyva's like, I would have to go to Indiana. Tyva can't go to Indiana. Why should Tyva have to go anywhere but Rockcastle County to be treated? This is her home, you know, and I want her to have the best quality of life. You know, I love her dearly. You know, I have a neighbor, Mark Isaacs. He's dying of cancer. Whenever he gets his oxycodone or Oxycontin filled, they send him home a Narcan shot because there's a possibility that he may die. Glenda Joe brought to my attention, well, what about these people they send those home with it? They're alone. Who's going to help those people? You don't have to send a Narcan pen home with medical cannabis. You don't have to worry about people dying with medical cannabis. So at the very first level of this is safer. This is safer, and science proves that. And use Google Scholar. Use your research in your universities. You can go to libraries. That's where you find your data, because there's so many opinions out there, and I don't want people to take my word for it. You know, I use other people's words. I want to listen. You know, I'm a tattoo artist. People are like, she doesn't know what she's talking about. But when I'm creating art for these people, I'm listening to their stories. And a lot of their stories have to deal with pain and the heartache of loss. And they're writing their story on their skin. and they're telling me their story in this process, and I listen, and I want to help people, and a lot of the people, some people have a stereotype in their head of the kind of people who get tattoos.
Mm-hmm.
But I tattoo doctors, and I tattoo lawyers. I've tattooed people from Japan to Ireland last month. People come here from all over the place. And, I listen, and they know that I can be a voice for them because my career does afford me the opportunity to not worry about, when I speak out about this, having to worry the harassment of getting drug tested or being questioned at work or having my views be reflected on an entire company. You know what I mean? I have that ability, and a lot of people do not, and I have a flexibility to switch up my schedule last minute to be able to attend these events. But don't think at all that I don't work my butt off at what I do. A lot of unpaid hours go into the things that I do, and I love my home. I just want this to be a better place for everyone. And I think in order for that to happen, we have to listen to everyone. And we have to find our common goals. And we have to find where we agree. And like I said, I think that we agree at the level of we want less harmful medications available to everyone. And I think that this is a less harmful medication. And my experiences and my education and everything that I love supports this. So I'm passionate about it.
Mm-hmm. Yeah, I can tell that you are. And we want you to know that we certainly, wanted to give you the voice that you asked for.
And I appreciate it so much, and that's why I reached out, because I know you. We all know each other here. We're family.
Yeah.
And
I wanted you to be able to present your feelings. That I read the text, and we were heading to see our son, and then after that, yesterday, you're lucky you got a hold on it, period, because this is another debt.
Well, I appreciate you, responding and stuff. I just felt like it was important, and, I don't like to get out and just speak on my own opinion. Like, we all have opinions. I want to help voice the opinions of others, and I'm always going to be there to show up for the people that I feel like are not getting to voice their opinions. And, where I differ with the opinions of some of the people on our fiscal court, is that I don't think that this is a decision for 5 people to make. I think this is a decision for the people to vote on. And if the majority of the people in my home decided that they did not want this, I would be fine with that, But I do not think that, the discussion should be limited. I do not think that access should be limited. I think that we need to talk about this and that the people should decide for themselves, because it's not my place to tell you what kind of medicine to take if your doctor says that's best for you. And I would rather have those jobs here. I don't want any jobs to not come here that would help people. These jobs would help people, and we have double the poverty rate.
What kind of jobs would that involve?
You would have processing. You could have farmers. That's why it's so important to go countywide instead of I did the alcohol vote in 2018. We petitioned that. We went citywide because I think it's the best of both worlds. You have people that, if they don't want to live by a liquor store, they can live in the country. But this is different because you need access in the city, but you need farmers to be able to grow in the country or in the county. You've got to be able to. This is an industry, I brought my backpack. Hemp. It's not just a medicine. There's so many jobs and opportunities that can come from this plant once we classify it the way it should be, and once we call it cannabis and recognize its value. It's not this scary, terrible thing that we've been taught, And when presented with the information, we have to have, the ability to change our mind. And that's hard to do. But I promise you, if I'm wrong, please tell me. I don't want to be wrong anymore. I want to be presented with the new information, and I want to go into research and form my opinions independently. I want people to think independently. I don't want you to believe just what I'm telling you. I want you to think for yourself. And I think that's part of our freedom in this country. And I think that it's important that people are able to vote on issues like this. And I think that these are things we can all agree on, like transparency and accountability in government and access to, less harmful medications. There's common ground with everyone. we're never going to agree with anyone on all things, right?
Right.
But we do all have common
Yeah,
ground.
and honestly, it's sort of, it's a tough kind of thing. I talked to the magistrate you mentioned a while ago this morning, and it's tough on everybody. And I'm uneducated, as you all know, and I worry about our children. I've got another child in high
Yeah, I have a
school.
14-year-old. Like
Yeah.
we have to talk to our kids. I know the way I was raised, a lot of times we didn't have hard conversations. Like we just did what we were told, right? But
Well, we have conversations.
or we rebel because we're told no. There's all those things, the aspects. But you have to talk, and you have to understand we can't control people. We have to try to make things better.
Yeah.
Like I said, what we have right now is not working.
Yeah. Well, it's certainly been good to have you up.
Thank you so much for having me.
I told you I would, and I did, and
I very much appreciate it.
I think it gives an opportunity for you tonight to have had a voice, and then I'm good with whatever the populace out there comes up with, whatever
Absolutely.
decision they make. I'm good with that.
We do plan on starting a petition to try to sign, and like I said, we might not get enough signatures. Who knows? I don't know. But I know that a lot of people have reached out. A lot of people are afraid because we're dealing with something that's currently illegal. So it's hard, and it's hard to have conversations with people that you love and know are not going to change their mind. And I'm fine. I just want that the person that disagrees with you to have the same power as the person who agrees. That's why we have one vote.
Yeah, and good. Be satisfied with the populace, and if it happens to fall on your side or happens to fall on
Absolutely.
the other side, then we go on, and not.
That's how democracy works, right?
It is, and that's one of the things that I've been raised to do right and to do the kind of things that is better for your community, and I have my personal opinions about the whole conversation that we've had here in the last 25 years. I started on this radio show talking about pills 25 years ago.
Oh yeah, my dad preached before anyone ever said.
And I've got a great deal of passion for, I lost a son to drugs, and I've got a great deal of passion for this.
Yeah, I
I
understand.
mean, I saw the tsunami coming, and
Well, there's no such
and I
thing
went
as
to
a
Charles-
non-addictive
I went to
opioid.
Charles Saver, and I said, Charles Saver, I said, I would love to take this issue on 20-something years ago. And he said, do you think you can handle it? And I said, yeah, I can. I can handle this. And,
It's hard though, isn't it?
Well, it's
And it's emotional.
It's been the most daunting task that I've ever seen. But on my side, I'm not going to give up. On your side, you're not going to give up.
Absolutely.
We're going to keep on, be passionate about our
And be
feelings.
respectful and kind to each other
Yeah.
because we're a community.
We are.
We are.
And I thank you very much.
Yeah, I thank you for having me.
Yeah.
It was good to see you.
You folks on Facebook, we thank you all for joining us. And Rachelle, that'll be hot till I turn it off, okay?
All right.
This is WRVK 1460 AM and W249BT 97.7 FM